champion on COVID-19. And I'm really happy to be here with Africa Bio and its partners to discuss diversity in clinical trials. This is an issue that is very, very important to the COVID-19 Commission, to the President of South Africa and his capacity as the champion on COVID-19. And the issue of positioning African biotech as premium biotech is very, very important to us and to the heads of state, and clearly also very important to President Al-Sisi. So let me start by saying a huge thank you to our heads of state, because without political will, none of us would be here, nothing can happen, because as you all know, biotech is an expensive enterprise, and we do need state support one way or another to be able to actually make it work. And in particular with clinical trials, you need the resources, you need an enabling environment, you need the people to actually be able to buy into these trials and participate in the trials. And so it's really very important that we have this political will behind us. And of course, this arena of the Africa excon is truly amazing, in that it strategically positions us very, very favorably out there in the world. And it's wonderful that Africa Bio is able to bring startup companies to a space like this. I think that it's highly commendable that you're able to actually bring these companies to a space like this, not only to connect with potential investors, but to connect with others who are already in the industry and to see how things are going, and what kind of markets that they're entering into and that they have to compete in. So I'd like to really say huge congratulations to you, Dr. Msomi, my dear friend and brother, for this wonderful work, and to all the partners that support Africa Bio. We really, really applaud your vision for actually being able to see the power of really allowing those who are innovating to break through. So with these opening words, let me now hone into the subject that we're talking about, is the issue of clinical trials. And let me start by saying that we have very, very good expertise on the continent. However, the presence of African countries in clinical trials still remains limited. And unfortunately, it's still kind of a pervasive problem. And poor visibility of existing sites, confined infrastructure, misunderstandings of requirements to work in the region, cultural barriers, and unpredictable clinical training regulatory timelines are some of the main factors impeding any investment in the area. And that's why I emphasize this issue of political will, because that's really where it starts, to be able to actually open up these factors for creating an enabling environment. Genetic analyses have shown that ethnic groups show variable results to different treatments, and Africa endures diseases linked to poverty more than any other continent, and I must say poverty and environmental factors like global warming, or rather climate change, that is the correct term now, right? But the interventions used to treat or cure these diseases are developed elsewhere. To gain robust and complete data that broadens the understanding of racial and ethnic differences in treatment processes, it is crucial that clinical trials must be conducted in Africa. And let me extend this background by saying, moreover, it is crucial that clinical trials deliver the promise that if you do the trials, you get access to the medication. Too often do we do trials, or do other companies advance diversity in clinical trials, particularly for Africa?
Thank you for having me on the panel. And
Just closer. Yeah. All right. Perfect. There are existing, pre-existing AI models. For example, there's been a lot of advancement in technology, and yet there's bias and lack of racial representation in these data sets. Case in point, democracy AI models are not able to detect or from racial diverse population. And it's against that backdrop that SAI is trying to tackle that by conducting a pilot in Africa where we use data sets of African women to refine existing AI models so that we can have models that are representative of African and validated to African women. In that way, we know that we are helping to help with the chronic shortage of radiologists, lack of screening infrastructure in the region, because the current models on the market do not work for the African population. If you use these models, you're going to create lots of false positives, and we need to tackle that by doing it ourselves. And that's why we want to use our own data set to do that.
Thank you so much. I think that's an excellent example that you've given us. There's two things there that you've tackled. Firstly, in terms of racial diversity, but also in terms of gender diversity. You know, ensuring that you actually conduct testing that is going to elicit the correct result for the correct demographic. This is really crucial. And as you were talking about it, I was actually thinking about the fact that women, certainly when I was practicing, which I stopped practicing about 5 years ago, that African women would present very late, with breast cancer, and often it was always because they're uneducated early. But actually, as it turns out, it's because we couldn't actually pick it up, and when I think about it, actually, your typical African woman is quite diligent about, doing their preventative medicine. Men are not so much, but women for sure, So this now starts to really elicit the truth of the matter, so that we can actually get to developing the correct technologies for good health outcomes. So I really love the example that you're giving. Now, let me come to you, Ms. Kemi Williams, and I'm going to put the question a little bit differently because it says what systems or tools can enable clinical trials diverse in Africa. Actually, I want to simplify it. Just tell us what must you, step by step, when you conduct a trial, what must you ensure? What are the essential elements that you must ensure are there to be able to conduct this trial?